suppose an obvious link is that, as I'm sure many people out there know, if they have had problems sleeping, is that if you're stressed, you're probably more likely to struggle to sleep. So unsurprisingly, I guess we get a similar response with anxiety and depression, that if you're worrying or you're ruminating in bed at night and thinking lots about bad thoughts, it's going to be harder to fall asleep. So we know generally that anxiety and depression are quite linked with sleep problems, particularly trouble getting to sleep. But we still don't know that much about perhaps the difference between anxiety and depression, why those problems are linked to sleep, where that might come from. So we've done some work recently, actually, which has been quite interesting, looking at trying to distinguish a little bit more about how anxiety and depression might differ. And we found in a study that we've just done that with young people with anxiety, they report having sleep problems, particularly on school nights, but not on weekends, which might suggest that their sleep is linked to their worries around school. And that might be about socialising, or it might be about their performance at school. Whereas with young people with depression, they report having a sleep problem every night of the week, so weekdays and weekends, which is quite interesting. We're starting to see perhaps a slight distinction between the disorders in how their sleep problems present. So that's really early, a really early finding. We do want to replicate that to be confident. But I think it is quite important that we start to think about how those problems will manifest for different young people.